Have you ever felt your legs tremble, weaken, as if they're whispering something you can't quite grasp? It's not just a stumble, it could be a cry for help from your heart. Every day, your heart beats to keep you alive, but when it struggles, your legs are often the first to sound the alarm. Don't let these small signs slip by unnoticed. Let's uncover 7 ways your legs might be warning you about heart disease, because sometimes listening to your body is the only way to save yourself. 1. Weak legs with shortness of breath, a silent alarm from your heart. Have you ever noticed your legs feeling weak and heavy, almost refusing to carry you, while you gasp for air at the same time? Don't brush it off as just tiredness after a long day. When weak legs come with shortness of breath, it might mean your heart is in trouble. Your heart works like a pump, sending blood filled with oxygen all over your body. When it can't keep up, your legs and lungs feel it first. Picture your heart as an engine pushing blood to every corner of you. That blood carries oxygen and nutrients to your leg muscles, giving them the energy to move. In heart failure, when the heart doesn't pump strongly or hold enough blood, less oxygen reaches your legs. They get weak, tired, and you feel like they're giving up on you. At the same time, your lungs don't get enough blood to swap oxygen, leaving you breathless, like the air just won't fill you up. It's not normal exhaustion. It's a sign something's off. You might feel this most when you're active, walking a short distance, or climbing a few stairs. Your legs might shake, forcing you to stop while you catch your breath. It's different from being out of shape. It hits even when you're not pushing hard. Some people say it's like their legs have no life left, paired with breathing that won't settle. If this keeps happening, don't ignore it. Your heart might be sending a quiet warning. Heart failure is often behind this, especially if you're older or have high blood pressure, diabetes, or a history of heart issues. When your heart weakens, it doesn't just affect your legs. You might feel tired all over, have chest pressure, or notice swelling too. But weak legs with shortness of breath can be the first clue, one people often miss, blaming it on age or sitting too much. What should you do? Listen to your body. If this combo of weak legs and shortness of breath pops up often, especially during light activity, jot down how often and how bad it gets. Then see a doctor. A simple test like an ECG or heart ultrasound can check if your heart's struggling. They might also test your blood for signs of heart stress, like BNP levels. Catching heart failure early can stop worse problems, like a heart attack or stroke, from sneaking up. Don't let life's rush make you ignore your legs. Weakness with shortness of breath isn't just a bother, it's your heart asking for help. Act now, even if it's just a quick checkup. You deserve strong legs and easy breaths, and your heart does too. 2. Sudden weakness in one leg, a stroke red flag. You're walking along, and out of nowhere, one leg goes weak, like it doesn't belong to you anymore. You try to keep going, but it wobbles, while the other leg feels fine. Don't chalk it up to a random muscle glitch. This could be a stroke, a serious heart-related emergency. When your heart or blood vessels falter, your brain can suffer, and it shows up in your legs. A stroke happens when blood flow to your brain gets blocked, often by a clot that started in your heart or a big artery. Conditions like atrial fibrillation, where your heart beats unevenly, can create these clots. If one travels to your brain, it cuts off oxygen to the areas controlling movement, like your legs. Sudden weakness in just one leg is a classic sign, often paired with a numb face, slurred speech, or trouble balancing. It's scary because it hits fast, leaving you confused about what's happening. Imagine this. You're in the kitchen, and suddenly your right leg buckles. You grab the counter to stay up. It's not like regular tiredness. It's sharp, quick, and one-sided. If it lasts a few minutes and fades, don't relax yet. That could be a mini stroke, or TIA, a warning that a bigger stroke might be coming. Your heart's at the root. If it can't manage blood flow, your brain and legs pay the price. This isn't always a stroke, but it's too risky to ignore, especially if you've got heart risks like high blood pressure, high cholesterol, or you smoke. These things make clots more likely, and when they move, your legs might be the first to show it. Men and women can both face this, but it's more common if you're older or have a family history of heart trouble. What can you do? If one leg goes weak out of the blue, especially with blurry vision, trouble talking, or numb arms, call for help right away. With a stroke, every minute counts. Millions of brain cells die each second blood's cut off. Even if it passes quickly, see a doctor. Tests like a brain CT scan, heart ultrasound, or ECG can pinpoint the cause and check your heart. Spotting issues like atrial fibrillation early lets doctors prescribe blood thinners or lifestyle changes to stop a stroke before it hits. Don't let a shaky leg turn into a life-changing disaster. Sudden weakness in one leg is your body shouting for attention. Listen up, get checked, and protect your heart and brain. One small step today, like seeing a doctor, could keep you standing tall tomorrow. 3. Weak legs with swelling, a heart under pressure. If your legs feel weak and look swollen, like they're holding water and weighing you down, your heart might be working too hard to keep up. Weak legs with swelling, called edema, are a common sign of heart failure, where your heart can't pump blood well enough. When your heart struggles, it doesn't just sap your leg strength. It lets fluid build up, making every step feel tougher. Heart failure doesn't mean your heart stops. It means it's not pumping or filling with blood like it should. When that happens, pressure builds in your veins, and fluid from your blood leaks into your tissues, especially your legs, thanks to gravity. Your ankles, feet, or even calves might puff up, and that extra weight makes your legs feel weak and tired. Since blood isn't flowing right, your leg muscles don't get enough oxygen either, leaving them drained and hard to move. Some say it's like wearing lead boots all day. Try this. Press on the swollen spot. If it leaves a dent that stays a bit, that's edema. Pair that with weak legs, like you can't stand long or walk without a break, and it's time to think about your heart. This often gets worse by day's end, after standing or sitting a lot, but in bad cases, it sticks around even when you rest. If your legs keep swelling and weakening over time, don't blame age. Your heart might be calling for help. High blood pressure, coronary artery disease, or a past heart attack can lead to heart failure. When your heart's weak, you might also feel short of breath, tired all over, or cough a lot. Older folks, overweight people, or those with a family history of heart issues see this more, but anyone can be at risk. Too many dismiss swollen, weak legs as a minor circulation hiccup, when really it's a sign of a heart stretched thin. What now? If you spot this, act fast. Try raising your legs when you rest. If the swelling eases, it's tied to blood flow. But don't stop there. See a doctor. A heart ultrasound or vein pressure test can show how your heart's doing. They might ask about other signs, like a racing pulse or chest heaviness, to get the full picture. If it's heart failure, early treatment with diuretics, lifestyle shifts, or even surgery can bring your legs and heart back to life. Don't let swollen, weak legs slow you down. It's not just a looks thing or a hassle. It's a reminder your heart needs care. One checkup could change everything. Keep your heart pumping strong so your legs can carry you far. 4. Pain or weak legs. When walking, a blood flow warning. Ever feel your legs weaken or ache after walking a little, only for it to fade when you rest? Don't assume it's just lack of exercise. This pattern, called intermittent claudication, might point to peripheral artery disease, a blood vessel issue tied to your heart. When your legs hurt or give out during movement, it's your body saying blood isn't reaching them fast enough. PAD happens when arteries in your legs narrow from plaque, fat, and cholesterol buildup. That cuts blood flow, so when you walk, your leg muscles don't get enough oxygen. You feel pain, weakness, or cramps, especially in your calves, that force you to stop. Resting helps because your muscles need less blood then. It's not like regular soreness, it's linked to blood supply, and your heart runs that show. Picture this. You walk a block and your calves tighten, weaken, making you sit. After a break, you're okay, but it hits again when you start up. That's PAD's signature. Some notice their legs feel cold or look pale too. Left unchecked, it's not just a walking problem, it's a clue your heart's at risk. Plaque in your legs often means plaque in your heart's arteries too. Smokers, diabetics, or people with high blood pressure or cholesterol face higher PAD odds, all heart disease risks. If you've got PAD, chances are your heart's arteries aren't clear either. It's more common past 50, especially if you don't move much, but poor diets push it younger too. If this sounds familiar, don't wait. Test it, walk a bit and see how your legs react. If pain or weakness kicks in every time and stops when you rest, see a doctor. An ABI test, comparing ankle and arm blood pressure, can spot PAD. They might also do an ultrasound or CT to check artery blockages. Early steps like cholesterol meds, exercise, or even artery procedures can keep it from turning into a heart attack or stroke. Don't let weak, achy legs hold you back. It's not just your legs talking, it's your heart and blood vessels begging for attention. Quit smoking, eat better, and get checked. Strong legs and a healthy heart let you walk wherever life takes you. 5. Cold and weak legs, blood not reaching its goal. Do your legs ever feel oddly cold, even when it's not freezing out, and weak like they can't keep up? Don't just think you're chilly. Cold, weak legs can signal poor blood flow, often because your heart isn't pumping well. When blood doesn't reach your legs right, they lose warmth and strength. Your heart sends blood everywhere, carrying oxygen and heat. If it's weak, say from heart failure or artery disease, less blood gets to your legs. That makes them cold, especially your toes or feet, and without enough oxygen, they weaken too. You might feel numb or tingly, like your legs are half asleep. Check this. Touch your legs and compare them to your hands or chest. If they're noticeably colder, especially with no obvious reason, and feel weak, like you can't stand long, it's a red flag. Older folks, smokers, or those with diabetes or high cholesterol see this more, as their hearts and arteries take a hit over time. In bad cases, legs might turn pale or bluish from lack of blood. Heart failure or PAD are usual suspects. In heart failure, your heart can't push blood far. In PAD, narrowed arteries block it. Either way, your legs suffer, and it could lead to sores or worse if ignored. If your legs are cold and weak, act now. Warm them with socks or a soak. If that doesn't help, it's about blood flow, not the weather. See a doctor. Tests like a Doppler ultrasound or heart scan can check circulation and heart strength. Meds, light exercise, or quitting smoking can get blood moving again. Don't shiver through cold, weak legs. It's not just discomfort, it's your heart needing help. Get checked to warm up your legs and keep your heart beating strong. 6. Constant cramps or weak legs, a heart running low. Do leg cramps hit you often, maybe at night or when you're still, leaving your legs weak after? Don't assume it's just dehydration or overdoing it. Frequent cramps with weakness might mean poor blood flow, tied to a heart that's not pumping enough. When blood doesn't feed your legs well, they cramp up and lose power. Cramps happen when muscles tighten suddenly and won't relax, often from low blood or electrolyte issues. Normally it's a quick fix. Drink water or eat a banana. But if it's regular, especially when you're resting and your legs feel weak after, look to your heart. It pumps blood with oxygen and nutrients to your muscles. In heart failure or artery disease, that flow drops, making legs cramp and weaken. Think of this. You're asleep and your calf locks up, waking you in pain. You rub it out, but your leg still feels shaky. If it keeps happening or hits when you're sitting, it's not random. You might feel heavy or numb too, and showing blood's not flowing right. Older people, diabetics, or those with heart history get this more as their circulation weakens. Heart failure, PAD, or atrial fibrillation could be why. In all, blood doesn't reach or return from your legs well, risking bigger heart issues like a heart attack if ignored. If cramps and weakness bug you, try water, potassium-rich foods, or stretching first. If it sticks, see a doctor. Pulse checks, heart ultrasounds, or blood tests can find the cause. Meds, gentle movement, or support socks might fix it. Don't let cramps and weak legs ruin your rest. It's not just muscles, it's your heart calling. Check it out to keep your legs steady and your heart happy. 7. Weak legs with a faint pulse, a heart losing push. Ever checked the pulse in your foot, say at your ankle or top of your foot, and barely felt it while your legs feel weak too? Don't shrug it off. A faint leg pulse with weakness means your heart might not be pushing blood hard enough. When that pulse fades, your legs are telling you your heart's in trouble. Your pulse shows how blood flows from your heart through arteries. You feel it in your wrist, neck, or feet. If it's weak or hard to find in your legs, blood's not reaching them with enough force. That leaves your leg muscles short on oxygen and nutrients, making them weak, heavy, and quick to tire. Some say their legs feel lifeless, especially standing or walking. Try this. Feel the top of your foot or inside your ankle for a pulse. If it's faint compared to your wrist and your legs feel weak, like stairs are a chore, it's a warning. Older folks, or those with high blood pressure or smoking habits, notice this more as their hearts and arteries wear down. In tough cases, legs might swell or cool off too. Heart failure or PAD often cause this. In heart failure, the pump's too weak. In PAD, arteries clog up. Either way, your heart's strained and it could lead to serious trouble like a heart attack. If your pulse is faint and legs weak, don't wait. Compare it to your wrist. A big gap means trouble. See a doctor. A Doppler test or heart ultrasound can check blood flow and heart power. Meds, light exercise, or artery fixes can help. Don't let a weak pulse and legs slow you. It's not just your feet, it's your heart needing care. Get checked to keep your pulse strong and legs ready for anything.